We would like to give a warm welcome to all our visitors at Suan Prung Psychiatric Hospital. Suan Prung Psychiatric Hospital is a 700-bed hospital under the supervision of the Department of Mental Health, Ministry of Public Health. It is located at 131 Chang Lo Road, Hai Ya Subdistrict, Mueang, Chiang Mai. It is responsible for 13 provinces in northern Thailand, including Regional Health 1, which consists of Chiang Mai, Chiang Rai, Lamphun, Lampang, Phayao, Mae Hong Son, Krai and Nam, and Regional Health 2, consisting of Phitsanulok, Sukhothai, Uttaradit, Tak and Phetchabun. This area consists of a population of 9.2 million. Vision: to excel in solving mental health problems across the country, especially those arising from alcohol-related disorders, and to develop systems of mental health and psychiatric services in Regional Health 1 and 2. Mission: to study, research, develop, promote, and pass on knowledge and technology concerning mental health and psychiatry, especially the problem of mental health caused by alcohol-related disorders, using a good management system, and to treat, rehabilitate, and prevent mental health disorders in the general population. Targets: 1. Patients with alcohol problems are treated across the country and never return to drinking habits. 2. Standardized holistic treatment services are provided to patients with mental health and psychiatric problems, focusing on those with the most complicated, complex, chronic, and severe problems. 3. The general population in the areas of responsibility is supervised and can access mental health and psychiatric services easily. Organisation of management. The organisation of management in Suan Prung Psychiatric Hospital is divided into 4 work groups: Administration, Medical Services, Excellence Centre for Alcohol-Related Disorders, and Nursing. These are all under the supervision of Sirisak Tididilakrat, MD, the Director of the hospital. Clinical Service. Suan Prung Psychiatric Hospital has a clinic providing clinical services to patients with mental health and psychiatric problems, including schizophrenia, auditory hallucinations, anxiety, affective disorders, stress, depression, dementia, and neurodegenerative disorders. The mental health problems of children and teenagers, including attention deficit disorders and aggressive behavior, mental health problems caused by alcohol-related disorders and alcohol dependence, and mental health problems from drug addiction, etc. Counselling Service. The hospital has several channels for accessing counselling services provided by an interdisciplinary team with specialty training and extensive experience. They are Telephone Service, Mental Health Hotline, call 1323 for 24-hour free counselling. Counselling Service before seeing the doctor at the outpatient unit, Suan Prung Psychiatric Hospital, on Monday to Friday from 8:30 a.m. to 2 p.m. Counselling service via the website of the hospital at www.suanprung.go.th. Knowledge Transfer. The hospital is a centre of study and knowledge transfer, especially concerning mental health and psychiatry. This includes several training programs such as the Mental Health Care Doctor Program, Psychiatric Pharmaceutical Caring Program, and Mental Health and Psychiatric Nursing Program. Moreover, the hospital is an academic source of medical and nursing study and practices in psychiatry for diploma and undergraduate nursing students, medical science students, and doctors working in clinics and hospitals throughout Thailand. The hospital is also a centre for study and observation of both domestic and international tours. Excellent centre of treatment and care for people with mental health problems caused by alcohol use. In the year of 2556, Suan Prung Hospital established the Excellent Centre of Treatment and Care for people with mental health problems caused by alcohol use. Responsibility. Number 1. Lead the organisation to become an excellent centre of treatment and care for people with mental health problems caused by alcohol use in the country by improving the performance of service, research and training, ultimately becoming a foundation for knowledge, both theory and performance. Number 2. Improve the collaboration of countries participating in the treatment and care of people with mental health problems caused by alcohol use, both inside and outside countries. Number 3. Combine resources together that deal with the treatment and care for people with mental problems caused by alcohol use, which includes the ways to improve, protect, treat and restore health within 4 dimensions. Number 1. Medical service. The duty. 1.1. Analysing the situation and potential treatment and care for patients with mental health problems caused by alcohol use at Swan Prung Hospital. 1.2. Seeking ways to improve work and the associated risk involved to do so, in order to improve the quality of treatment and care for people with mental health problems caused by alcohol use in the Super Specialist Service Level 3F and the Standard of Excellence Centre. 1.3. Work jointly together with Specialty Excellence Centre in order to improve the treatment and care and research job. Number 2. Dimensions of Research Centre. The duty. 2.1. Study and analyse the potential of the headlining research to improve clinical performance to the best standards and set work guidelines for researchers in order to improve the quality of treatment and care for people with mental health problems caused by alcohol use in the Super Specialist Service Level and provide the best treatment and care for mental health problems caused by alcohol use, all while working together with the medical service. 2.2. Select the best methods to perform work and act as the consultant for the researcher. Seek possibilities and draft regulations for research done by the researchers, both inside and outside the organisation, prior to sending the research done by employees in Swan Prung Hospital to the Ethics Authority. 2.3. Support the study of researchers in the organisation and the participating organisation. 2.4. Examine the research in order to achieve the best treatment and care for people with mental health problems caused by alcohol use in the country and research cross-culturally to achieve a universal standard for Asian countries. Number 3. Dimensions of Training Centre. The duty. Planning and working on study formula. Set activities for learning in order to provide the best treatment and care for people with mental health problems caused by alcohol use in the country until getting support from Occupation Council. Number 4. Dimensions of Database and Planning Centre. The duty. 3.1. Improve the system of the Resource Foundation in the area of treatment and care for people with mental health problems caused by alcohol use at the country level. 3.2. Improve the Resource Foundation of knowledge in the area of specialty unit, the job in the area of knowledge that relates to the mental health department. 3.3. The management and planning performance plan of the hospital in order to reach the organisation's strive for excellence where those who receive service will be given the best advantage. 3.4. Develop an efficient pass-through system. Prizes of Pride and Honour. Swan Prung Psychiatric Hospital was the first hospital of the Department of Mental Health certified by Thailand International Public Sector Standard Management System and Outcomes. PSO 1101 Data System. It has also been certified as a health promotion hospital. The hospital has been certified with the standard of HA since 2003 and has passed inspection concerning hospital system quality until present. The hospital was awarded Honoured Regional Health Service in 2012 in Psychiatric Regional Health by the National Health Security Office, NHSO. From the intention and dedication of all personnel in Swan Prung Psychiatric Hospital over the past decades, we aim to be a hospital of excellence for alcohol-related disorders in Thailand, and to develop the mental health and psychiatric service system in Regional Health 1 and 2, with high capabilities and a good integrated management system in order to constantly achieve the highest satisfaction for both facilitators and clients.